am a nurse by trade. So I've been a nurse for 28 years, which means I started nursing school at 3. So a nurse for a long time. And my background stems from critical care. So I started in the critical care space and, going through the hospital setting, then all the way into the private healthcare setting and being able to start into management. And so working in the private healthcare sector in physician offices, managing, directing, and was lucky enough also to run one of the largest FQHCs that we have in Illinois as well. And so doing that in conjunction with working for another MSO, led me into value-based care, and was fortunate enough to know several people. I was able to connect and come over to Innovista. So it's been a true pleasure. It's truly the people that I work with. I know that can seem like, such an obvious, sort of answer, but it's true. I've been so blessed with the ladies that work with me, and some of them I known from past work experiences. Being a leader with these ladies keeps me, going every single day. And one of the greatest things is, you know, a mentor once said to me is that the ship will sail when the captain is down below. And I can say that with 100% certainty that I have a team underneath of me that I do not consider being underneath. We walk in cadence together, and we work in a non-siloed environment. We intersect, we teach, we learn. There are days, despite the fact that I might be their director, they teach me. That's the greatest part. We might learn from another department something that we didn't know. And that's what makes you wanting to come back and make it such a great environment to work in, is that diversity and that opportunity to intersect with other people and truly learn from their experiences in order to grow in the space that you're in. I think it's really based a lot on what I mentioned earlier. I think without having those years of experience in, a critical care setting where you had to think on a moment's notice, it was very fast paced, very driven, non-emotion. You had to really just think and go, 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 go. And then going into that other space of in the private sector and working with physicians, working with everywhere from nurses to MAs and so forth. And so by doing all of that, it was able to bring me into a very interesting time, which I didn't realize, but I was able to experience. I saw the transformation of paper turning into EMR. I went through that transition, and then I was able to get into the space where we did meaningful use. And so, again, without knowing where that was going to go and blossom, that transitioned into what I'm doing now. And then also, when I worked for the FQHC, I became PCMH certified as well. Also transitioned into now, there's so much emphasis on the social determinants of health, and we were working with HRSA guidelines, and so meeting quality marks. And so because of all of that, I changed gears because I started to see the paradigm of healthcare shifting. No longer were we going to the doctor because we were sick. Now we've shifted gears, getting those people in for those preventative care measures, seeing that transformation, almost reteaching people the importance of staying healthy and staying well so that we don't become sick and we don't become high utilizers, in the ER and being hospitalized. And so that's been that incredible journey of taking what I've done in the past and implementing it into what I'm doing now. And it's still continuing to evolve and to still grow. I think we are in a very unique sort of bubble right now. Our largest denominator of our patients right now are what we call the boomers, our baby boomers. And I don't know if we expected that. And we have centennials now, which is fantastic. But as healthcare providers, I was like, no, I don't think we expected that to happen. So how do we help them continue in their journey? How do we help them, stay on that path of wellness and optimal health? and get them to where they need to be, all while still navigating that next step is maybe the generation of either myself or below me, and keeping sort of like those training wheels. We've got to take the training wheels off, remind them prevention, prevention, prevention. And that's where we need to keep going, keep educating and supporting our physicians and our physician offices. I can't emphasize that enough. They're overwhelmed. There's a lot they have to do. They've got this much, to do in about this much amount of time. How do we, as a service organization, help them navigate that road and keep them happy, content? They don't get burnt out as providers. Have the patients leave feeling heard, feeling good about their visit, understanding all the things, remembering all the things that were told to them. And so I think the next journey of healthcare is continuing this cycle of listening with intent, making time for our members, making access available for them, and making it almost it's customary. Like it's just something they expect. Every year I know I do this. It's not new anymore. It's just something that it's automatic. And I think if we can get there, we're going to achieve greatness. I think the biggest thing that I would think patients are looking for is access and accessibility. It doesn't mean that we, create more clinic type settings, more of an outpatient settings. We need to take a really deep dive into, I'm very passionate about looking at the whole picture of early morning hours. Does it mean late hours? Does it mean weekends? So that members can continue their day-to-day life, but still attend and those very important visits and go to that. We
Yeah.
also need to focus on, asking those tough questions. Are you okay? Sometimes the greatest thing we can say to someone is, how can I help you? We may not have all the answers, but
Right.
sometimes that's all a patient or member wants to hear. It's just
Yeah.
that they're being heard. But what can we do to help you? And the initial problem that maybe they came into the office for, as you start to sort of peel those layers apart, you might end up with a completely different resolution at the end of the visit. So
Yeah.
making sure that they understand and that we're taking the time to offer that assistance to them. They may not be able to afford their medications. We never want to get into a space where someone is having to choose between, do I eat or do I take my medication? We as healthcare organizations can make that not happen. What a fantastic place that would be in. And asking our members what matters to them. What is it that's important to you? From our lens, we might think it is all those things I might have mentioned. But maybe if we take the time to ask the member what's truly important to you, we might actually, again, learn from them, which will help us navigate our next road and where we need to be.